I don't know that I've ever seen a better community response. We were given connections and introductions to the school system, to the Hispanic task force, to the business community, and it really allowed us to not feel like we were coming in and visiting and doing testing and then leaving, but rather we got to get a snapshot into what life is like for the folks that we wanted to serve.
And I'm working right now with the Gainesville Against COVID-19 Task Force. The reason why we got started was because the Latino community was getting infected in higher numbers, and we were concerned.
Really, we all rallied around together to talk about how we could outreach to the community, and we learned some very valuable lessons about just how different cultures accept health information, what it means to them, how it comes across.
The hospital has really reached out to reach business owners, professionals, workers in the community to say, hey, we want to make sure we cover everyone in the Hispanic community to understand where testing's at, where the resources at.
We also felt like it was our responsibility to share that burden with the health system and the community as a whole. By us providing testing, we're utilizing our PPE, we're utilizing our staff resources instead of adding to the burden to the other organizations, the health department and NGPG and the hospital in their testing.
For things to be successful, such as the COVID testing, you need to reach out to agencies who have relationships in the community. So I know early on they reached out to Good News Clinics to do COVID testing.
And Northeast Georgia Health System came to Good News Clinics and asked if we would host alongside them some community testing events geared toward the low-income population. We set up 2 large tents that 4 cars could pull under at a time each. Cars were lined up to drive in under the tent and wrapping around the block for several miles. In doing so, we tested over 1,300 people, so we were able to begin to look at grassroots efforts and ways to stop and slow the spread as quickly as possible now that we had a handle on just how severe it was.
At a time when the masks weren't as readily available as they might be now, our families were desperate, and so the health system kind of pivoted and helped us get those made and distributed on our buses.
The taxi companies, we were very well received by them, letting us disinfect their units as well as doing the no mask, no service.
And so that opens other opportunities for the hospital to say, what can we do to take it a step further to help them or help those in need that cannot quarantine or cannot reach us?
And I think the beauty of all of this is that we are able to pick up the phone and say, we don't know how to approach this aspect of reopening school. Can you give us some advice? And we have direct access to the leaders of the health system, of the teams that are working on the coronavirus.
We cannot do community health improvement work by ourselves. We each bring different perspectives and we each bring different strengths, and we all have a part to play.